Good morning and welcome to that. My name is Lisa Rantz and I'm president for Hawaii State Rural Health Association, and we host the rural training track of the Workforce Summit. So we're really excited to have you here today, and we hope that you'll enjoy this session and the next two sessions coming up. Our mission is to advocate for rural health issues and promote communication, education, and research of issues related to rural health. Our vision is to be your collaborative healthcare leader for rural communities across the state of Hawaii. We're really looking at three goals when we look at this. We do a lot of work around workforce development and advocacy and education, both on access to healthcare close to home, but also for providers and the infrastructure that they need to be able to provide that care and also make it sustainable. And our third goal is developing that rural robust network. We advocate for rural patients to have equitable access to timely and appropriate care close to where they live. And also for our rural providers. We do a lot of support on recruitment and retention. On the retention side, with loan repayment and HSRHA designations and preceptor tax credits, relief from the get, you name it. So we're up to helping with all of those things so that we have a robust rural healthcare provider network. And our signature activities are our Rural HSRHA, which we're attending today. So once again, I'll thank you for your participation. As I go through this presentation, to really consider joining our organization and having your voice heard and helping us to have that stronger voice to advocate for our needs across the state. If anything, what we're going through with COVID and the pandemic right now has really highlighted those needs and the fact that we really need to work together. One of the projects that we would love for you to check out is our Project Echo Hawaii series. That's our telehealth program, where you can talk with other providers and find out what's the latest and the greatest and work with de-identified cases around behavioral health, geriatrics, our substance use platforms. And then we hold an annual Rural Health and Community Caucus. We're going to be having a session coming up in November. So I encourage you to visit our website to get updates on that. And then we have a couple grants. We're in our second year of the Hawaii Opioid Prevention and Education Program, and I'll talk about that in the next slide, showing some of our various partners that we've been working with to develop this infrastructure. And we would love to add you to this slide. So I'm just going to keep pushing the value of partnerships and collaboration with the organization. One of the things that we were able to do that we're getting ready to launch is through conversations, we know that we've identified a certified nursing assistant shortage on Lanai, and we're able to work with the different, listen to their needs. We connected together the Hawaii Center for Nursing, Maui Community College, and employers such as Halimokua and Lanai Kinaole to develop a model to fit their unique needs that they need within their communities. And these organizations need CNAs, so we're able to work through these partnerships and develop a training course so that they can get their certifications, you know, do their online classes, and then of course their clinical rotations and get their certifications. So that's all I talked earlier. And then when we look at our next project that we're working on, in order to really identify more of those needs and to engage with our partners, we're launching comprehensive community health needs assessments across all our islands. The first one is started on the Big Island of Hawaii in collaboration with Community First, the Department of Health, the Pacific Basin Telehealth Resource Center, Hawaii Health Systems Corporation. And basically, we're going to be conducting some focus groups with our different providers, you know, not just the specialists or the hospitals, but our primary care providers, our behavioral health providers, and just really finding out what's working well, because we know that there's a lot of great things happening out there. And then what do our providers need to make those things sustainable? What are those supports that we can get from the health plans, from the county, from our congressional delegation? What pieces do we need to help make those things happen? And once we identify those things, then we will do a broader, I guess we're going to call it a market survey, and go out into the community and really find out what the community members see. What do our rural folks, do they have access to care? Can they get care when they need it? What kind of care do they think that they need? What platforms are they looking to get their care in? Is care changing or telehealth? We know what we think we know. These community health needs assessments are going to help us identify and gather data for the things that we think we know, right? So we want to make sure that we have the data to support that. And the first needs assessment for Hawaii Island will be completed by the end of the year and presented to our legislative body. These will also be posted on various websites, the Hawaii State Rural Health Association website, Community First, the county. And then we're going to be moving on the rest of the counties so that we have a really comprehensive view of what are our similarities, what are our differences, how do we need to work together to really address these issues and to have vibrant, healthy communities. And it all starts with health. So we encourage you to engage with us on that project as well. When we look at our HOPE grant, here's something that I think we can all probably use or refer a friend, a patient, a loved one to, is our Hawaii Util. It's a free online platform where your loved one can visit with a Hawaii licensed mental health counselor, psychiatrist, a nurse practitioner, or psychologist. And all you need is internet and an email address. So you can go right, click on that QR code, go to the website, super easy. You just say that you need to see somebody and you can get connected immediately, or you can schedule an appointment for a future time. And there's no limit on the amount of times that the person can be seen. But it, really helps connect body and the brain and help with some of our shortages in that area. Other things that are happening under our HOPE grant is we developed caring teams in rural communities on each of the islands to identify and address substance use issues unique to each of the communities. We have some jail reentry bridge programs happening on Kauai. Once again, encourage you to visit the website to take a look at that, providing that support in the bridge until they can get set up with medications that they need. We're starting a new MOUD project with Project ECHO. That'll be starting in late September, which was funded by the Hawaii Harm and Health Reduction Center. And then we also on Hawaii Island developed HAPN, the Hawaii Addiction Provider Integration Network. So right now this is just on Hawaii Island and it's being led by West Hawaii Community Health Center, bringing together the different providers that are working in the area of substance abuse, with working with the primary care providers to really integrate those services and be able to get that support from folks that are specialized in that area to help address substance use, because we know that substance use isn't always at the far end of the spectrum. It's our moms, it's our young people, it's just drinking a little bit too much alcohol that leads to other things. And so just being able to identify folks in your and being able to support them in the best way possible. So there's a great network there. And then we have a new grant with HSRHA, which is our Hawaii COVID-19 Vaccine Access Project. And the purpose of this grant is to really start addressing those health disparities and to advance our health equity by mobilizing our rural community partners to educate and assist individuals in getting the COVID-19 vaccination, working with our community health workers, our patient outreach folks to provide educational materials, whether that's social media or via a webinar at different outreach sites across the neighbor islands to really just get that misinformation squashed and really give people in our communities the information they need to be able to get the vaccine. So much more information to come on that as we just are launching the program. And just more about some of the infrastructure that we've worked with our partners with over the years is, around our recruitment and retention. We know every little bit helps, so that preceptor tax credit, you can get up to $5,000 a year right off the top of your tax for that. We are looking to expand it so that it includes more disciplines and specialists can get on that tax credit. So we'll be reaching out to you. If you want on our email, please shoot us an email, which will be located at the end of this presentation, so that we can get you looped in and really have a strong voice to get those things changed this year as we move into the legislative session. Hawaii state loan repayment, of course, wasn't funded this past session, but we did have our county step up, which I'll identify that coming up here. But really working on, what that reimbursement rate looks like for our providers, some general excise tax reform. We are the only state that does tax healthcare services, so working to get some of those things done. And then, of course, keeping our health profession shortage area designations in place is a huge benefit to our providers, because it does provide a 10% quarterly bonus payment, and who cannot use an extra 10% on their paycheck or on their bottom line. But that's what these countywide HPSA designations provide for, and that's on direct billed Medicare services. And Hawaii's been about getting everybody healthcare and into these managed care plans. So we've been working with our congressional delegation to see if we can get this payment a little broader for you guys. So, some of it's like herding cats and chipping away at stone, but we're willing to do it. Here's some of the designations. This presentation is available, so you can go back and check that out, but each county does have a countywide designation. And how we keep this designation. Doctors are on the front lines. They deal with the healthcare workers, and we need to get a hold of Allison McCooney, who works in the Office of Primary Care and Rural Health and works diligently to help us maintain these designations. So when you hear of a provider that has retired, and many of our providers are working well past retirement age and actually dying on the job, which, that's not okay. So we need to do more so that we can bring our kids back that have gone away to get their health degrees. But you just need to shoot her a quick email and let her know that a specific provider moved off island, passed away, retired, cut back on services, and that way we can keep those designations going. Any questions on that, you can certainly feel free to reach out to us on our contact information. And I did sort of allude to this a little bit earlier, is we really are creating a neighbor island network. When COVID hit, a state legislature shut down in 2020, it really exacerbated, really brought to light that, only together, working together as the neighbor islands, will we be able to overcome these rural health provider shortages. And what really was heartwarming in talking with the counties and letting them know that we have providers that are struggling, that need that loan repayment. Hawaii County stepped up and provided $100 repayment, which means we also were able to get the federal match to be able to provide more loan repayment to our providers. And when that happened, Maui County, when we talked with them, they were like, well, we can do that too. And so they provided $65,000 for 2 providers on Molokai. So the network is working, and we encourage you to join our network on that. There's various loan repayment options. Of course, the big umbrella is the Hawaii state loan repayment program. And this has had eligible disciplines, and you need to work for a nonprofit and be in a health profession shortage area. But we expanded and we added to that program the solo and small practice loan repayment program. So you no longer need to just work for a nonprofit. So this is designed for our solo and our small practices in areas of significant need. So you still do need to be in a HSRHA area, but almost all of our areas in Hawaii are HSRHA areas now. But we provide the match. So either through Hawaii State Rural Medical Center Foundation has funding, the counties have stepped up to provide funding. And so you can actually qualify for the Hawaii State Loan Repayment Program now. And there's public service loan forgiveness, which you have to make 10 years of qualifying payments and work for a qualifying public service or nonprofit employer. But that is a program that is available here in our state. And then the Hawaii State Rural Health Association has the Berry Taniguchi program. And this is open to all health professions in rural areas to help meet the workforce needs of our communities. Through that vaccine access grant, we were actually able to obtain $150,000 to put into this program. So our programs are all growing. We also, through Hawaii Community Foundation, Hawaii Island Access to Medical Care Fund, but you have to be a graduate. It's a little tighter. You have to be a graduate of a Hawaii Island High School, and of course work in the county, and a 5-year service commitment on that. But there's several options, right? So we're trying to make it as flexible as possible. You know, it could be matching monies for the state loan repayment. It could be a subsidy direct to the provider to be able to get supplies and equipment, moving expenses, purchasing, you know, a home to live in, any of those types of things that will keep you here in Hawaii. And then it could also be to the employer to offer a more competitive salary and to help with the onboarding and licensing process that we know takes a little bit of time, and in an effort to help offset some of those costs until the provider has a full patient panel, approximately 2 years. So we're excited to announce that as well. And, you know, I just want to really drive home the point that Hawaii State Rural Health Association, we are your rural health policy foster operations. We're leveraging our capacity and resources and strengthening our rural network. So, you know, by working with us, we want to hear those needs so that we can help make connections and address those. So if you have a heart for rural health, I'm going to throw it out there. It is only $20 membership fee for the year. And we encourage you to join our association and help build a stronger network. There's some information for you. And I'm sorry I wasn't able to be with you live, but you're definitely in good hands, and really excited for the next half of the session here with Dr. Laura Swade and Dr. Scott Groschkreitz with our Hawaii Physician Shortage Crisis Task Force. And I know you'll really enjoy them, and they've got a lot of great things to say. So thank you all for being here, and I look forward to working with you and engaging with you for doing some of these around rural health. So thank you again, and enjoy the rest of the Workforce Summit.